Pushing a healthcare overhaul, Bernie Sanders unveiling his new proposal as he aims to win the White House in 2020, saying that the American people want Medicare for all.
They want a healthcare system which will lower healthcare costs and save them money. They want a healthcare system which will guarantee them freedom of choice in terms of the doctor or hospital they go to. They want a healthcare system which will substantially lower the cost of prescription drugs.
I mean, that would be great. Joining us now is Bob Moffit from the Heritage Foundation. Is what he described there Medicare for all? Because the way I understand the economics behind Medicare, the reason why it's so fantastic is because people take out in value about 4 times what they pay in.
That's right. Medicare right now has got financial trouble. In fact, it has an unfunded liability over the next 75 years of about $37 trillion, which is bigger than our national debt. But the fact of the matter is that under Medicare for all, your choice of health coverage disappears. If you are in an employer-based health insurance plan, you will lose it. If you have private health insurance, you will lose it. About 181 million Americans will lose their existing private health insurance plans. You will get the government plan and only the government plan. And if the government plan cannot deliver what you want or need, you have no alternatives.
Yeah, unless you have money. And then you just go outside the system. And so it creates exactly a 2-tiered healthcare system, you know, which is what they say that they're trying to do away with. And in fact, what they would really do is reinforce that. At the same time, you know, it is so easy to point out what's wrong with everyone else's plan. It's very hard to come up with a way to fix this one. What do you think would be the first step in the right direction? Not solving the whole thing, but if we wanted to improve things today, what's the first thing you'd do?
Well, the first thing you would do is basically solve the problem of people right now who are being priced out of coverage. People in the individual and the small group markets have been hit with premium increases that have been double-digit over the past 5 years. We had a situation between 2013 and 2017 where premiums in the individual market went up 105%.
How do you fix that?
How do you fix it? Basically, what you do is you give the states the authority to establish rules governing health insurance. You give the states the opportunity to craft health insurance plans that are directly beneficial to the people in those states, and you recognize that there is a radical diversity of health insurance markets from one state to another, and allow health insurance plans to compete with a much more flexible system.
What do you think about the idea of 5% of the population spends 50% of the dollars, according to the Kaiser Foundation? What if you put them in a high-risk pool and you directed all the federal dollars at that, and then you reinsured that market and laid off the risk to Wall Street? What do you think of that?
Actually, that's what's happening right now with the 1332 waivers under current law. In other words, if a state wants to set up a health insurance risk pool, which is, again, tailored to the demographics of the state, well, then the state can do that. And we've seen that happen in Maryland, and we've seen it happen in Minnesota and Alaska. It works very well. Premiums have declined significantly in those states. So you don't have to create a federal program to do this. What you've got to do is let the states have freedom to design their own health insurance markets, fix rules for their own markets, and allow them to give them the flexibility and the freedom to tailor those plans to the people that in those states.
We have breaking news. We've got to go, but I love your thoughts. Thanks for coming on. Come back soon.
It's a pleasure. Thank you very much.